and I'm a board certified music therapist. Today, I'm going to talk about what music therapists do, where they work, and how to become one. I've been a music therapist for more than 10 years, and I work at Joyful Music Therapy here in Orlando, Florida. Joyful Music Therapy is a private practice that provides group and individual music therapy sessions for people of all ages. Mostly we work with children and teens with special needs. So, what is music therapy? Well, it's a healthcare profession. It's different from being a music teacher or a musician who plays in a band for a living. So, a music teacher teaches music, right? They teach music appreciation, or they teach you how to read music, how to play instruments. And it's very different because music therapists base their music therapy sessions, on different goals. And those goals are always non-musical. So we're looking at a person's ability to count, to think, to problem solve, a person's ability to use their bodies. How do they move? Do they have a physical disability? Do they have a cognitive impairment? Or we might use music to help somebody who is grieving because they've lost something. Or we might use music to help someone in the hospital who's having a lot of pain or anxiety about being in the hospital. And so we come in and we do music therapy with them to help them deal with their feelings. What's also different is our degrees are very different. We have a degree in music therapy, just like a music teacher has a degree in music education. We have a degree in music therapy. And I'll talk more about what we study later. But it's a 5-year degree where you do 4 years of coursework and then you do a 6-month internship, you graduate, and then you can apply to take the board certification test. And you have to recertify every 5 years. So, where do music therapists work? Some music therapists work in hospitals. They provide services to patients in the ICU, which is intensive care unit, the NICU, which is the neonatal intensive care unit for babies who are born prematurely. They work with cancer patients. They work in many different parts of the hospital providing music therapy services. Music therapists work in nursing homes with elders, or call them older adults as well. And these are mostly people over the age of 60. They're in their 70s, 80s, 90s. We even know people who are over 100 years old. Music therapists work in facilities that provide physical and occupational rehabilitation. So they're working on relearning to walk or using their hands or being able to feed themselves. And they also work in facilities that provide substance abuse rehabilitation, so people who suffer from mental illness related to drug and alcohol abuse. I work in a private practice, and that is when a music therapist decides to make their own company. That's called private practice. They have to understand how to run a business and provide music therapy services. The company I work for provides services to people who live in Orlando, Florida, and we advertise what we do to the community to get new clients, and we work with people of all ages, all the way from little kids to people who are older and who are elderly. And music therapists, we work in many different places. We work where people need to heal, feel better, or they need to grow, and so that they can be a part of their community. So, who can benefit from music therapy? What kind of people do we see? And the answer is all ages. I mentioned that before. We work all the way from babies to older adults, people in their 80s and their 90s. We work with people with special needs, so people who have Down syndrome or autism, or they might have a neurologic disorder like cerebral palsy, where it affects their bodies. We work with other people with physical disabilities as well, whether they're born with them or whether they've experienced an accident and are no longer able to walk or do things for themselves. We also work with people with acute or chronic pain. That means that they either have pain all the time or it comes in waves and can change. And so music can help with managing your pain. We work with people with mental health issues, so people who are experiencing anxiety or depression, we might work with them, or other mental health issues. We work with wounded warriors, who are people who have served our country. You'll see music therapists working in veteran hospitals as well. You'll see music therapists also help families and caregivers and other professionals. And we also work with people who live in nursing homes who might have dementia or Alzheimer's. What do music therapists really do? As I said earlier, we use music to accomplish goals. That means we play instruments, sing songs, and play musical games to help our clients or our patients. Now, let's talk about cognitive skills. Cognitive skills, or cognition, that is your ability to think, solve problems, complete a sequence, so like buttoning your shirt or brushing your teeth. Cognitive skills are also your ability to do your academic work, such as counting or knowing your colors or your numbers or doing math. And a way a music therapist might help a child with autism learn their colors or numbers is by singing together and matching the colors or the numbers. Physical skills. Physical skills are your ability to hold and grasp things. It's your ability to walk, to balance, play sports, games, or music. It's any physical activity you might enjoy. So a music therapist may help a child who has difficulty controlling their movements by playing drums or other instruments to strengthen their muscles. Social skills. Social skills are knowing and understanding how to communicate with people. This means you understand verbal and nonverbal cues. A verbal cue is when someone speaks to you and you respond. A nonverbal cue is when you communicate using your body, such as putting your finger to your lips. A music therapist might help a child to interact appropriately during a group, such as learning to tolerate waiting or taking a turn and keeping their hands to themselves. Speech and language. Speech skills are the ability to communicate effectively. Language skills are the ability to understand speech. A music therapist can help someone relearn to speak who has had a brain injury or a stroke, or help a child learn to speak. How do I become a music therapist? Glad you asked. First of all, you have to apply for an accredited program. So you can look online, you could look up music therapy degree, and it's going to pull up schools that have been accredited, meaning that they've been approved by two different organizations called the Certification Board of Music Therapy and the American Music Therapy Association. And they approve the schools, saying that they have all the standards to train somebody to become a music therapist. And it's a 5-year program for most places when you're doing your bachelor's in music therapy. So you do your 4 years of classes, and then you do a 6-month internship, and then you can take the test and get your certificate to be a board certified music therapist. Also, you can get your master's in music therapy. So that's the degree that comes after bachelor's. So you finish high school, then you can get your bachelor's, then your master's. And your master's degree can either be just becoming a better music therapist, where you're doing what we call advanced study, or you can get your bachelor's in like music education or music theory or history, and then you can apply to do a master's program in music therapy. But you also have to do your internship as well if you're going to do it that way. A lot of people start out in the bachelor's or in the master's program. So in this program, you have to become proficient, meaning you have to play with a good tone, pleasing quality. It has to sound good, right? You wouldn't want somebody walk in your hospital room and play a guitar and it'd be out of tune. You'd be like, get out of here. So we have to be proficient in playing piano, guitar, and voice. So we have to sing with a pleasing quality. We have to sing nicely, and it has to sound good, or again, you wouldn't want to come see a music therapist who couldn't sing well. So we have to study those three things. And then also we have to take all these classes. So we take music theory and history to start so that we can understand music and how it works, so that we can write songs, so that we can play our instruments effectively. And then also we take biology, anatomy, and physiology, and that's so we can understand the brain and the body, and we can understand how disease or disabilities affect the brain and the body. And then we also take psychology as well to know how to understand different ways to help people. So we take psychology and we take some counseling classes so that we know how to listen to people and how to support them without judging them or making them feel badly about anything. So you have to do all that to become a music therapist. At least a bachelor's or a master's in music therapy, and then you can take the board certification exam. And you do have to recertify every 5 years. So you have to get 100 continuing education credits to be able to recertify. So I've recertified twice, and in the next few years, I'll recertify again. And it's great because you get to continue to learn and grow and become a better therapist to be able to help people. What are some qualities a music therapist needs? Firstly, I believe a music therapist needs to be hardworking. It's not easy to get this degree. There are lots of hoops to jump through. There's a lot to learn. There's a lot to study. As I explained in the degree program, you have to take many, many classes. It takes at least 5 years to become a music therapist because you at least have to have a bachelor's in music therapy. And then if you decide to get a different bachelor's, like in music education, and then decide, oh, I do want to be a music therapist and change to a master's degree, you have to get a master's degree. So there's a lot involved, and you have to be hardworking and determined to do this. I also think that you need to be a compassionate person, somebody who sees somebody suffering or sees somebody hurting and you want to do something about it. Something I didn't put on there is a love of music as well. I think that's a given, that if you want to be a music therapist, you have to want to use music to help people. You have to have this desire to care for people using music. When I was a student, I went to school, I went to college, and I was a freshman, and I was I was a percussion performance major, so I was going to major in performing. And then I found out about music therapy at the end of my freshman year, and I fell in love with the idea of being able to use music to help people. I had no idea what I was getting into. I didn't know how much hard work was involved, but I'm definitely a determined and passionate person, and I think that it takes so many of those qualities to become a music therapist. I think that if you care about people and you're hardworking and you're determined, that you'll become a music therapist. So I hope that encourages you, that if you think maybe someday that's something you'd like to do, that you can. I wanted to share with you some ways that you could use music to help people or to help yourself. We often use music for our own self-care, to help ourselves feel better, or even to feel something more deeply. Like if you're upset about something, you probably don't listen to happy music. You probably listen to angry or sad sounding music to help yourself get through what's happening. Now, you can't call it music therapy because you're not a board certified music therapist. Just like I can't do physical therapy. I can use music to help someone with their physical goals, but I can't call it physical therapy because I'm not a certified physical therapist. But you can use music to help people. So what are some things you can do with your friends or with your buddies at school? You can listen to your favorite music together, share songs, talk about your favorite artists, talk about what those songs mean to you. Look up the lyrics, read out the lyrics. What does it mean? How does it apply to your life? Obviously, you can dance together. Dancing's a lot of fun, being silly or doing serious dancing, coming up with routines, all the way from very simple to complex. Make up silly songs. A lot of times you can make up a really silly song in the moment where it's something that you come up with, or you can do something called a piggyback song where you take a song and you use it in a different way. So an example of a piggyback song would be if you took Twinkle Twinkle Little Star, instead of saying Twinkle Twinkle Little Star, you could say, it's time to go to math class. Let's all go to math class. It's a really easy one, but you get the idea. You could also change the lyrics of your favorite song. So you could rewrite one of your favorite songs. If you have some instruments, or if you're at home, or if you're somewhere where you have access to something like a pot or a pan, you can always pull out a pot and a pan and go to town, have fun. I wanted to share some resources with you. If you're interested in finding out more about music therapy, you can go to the American Music Therapy Association, it's musictherapy.org, or you can go to our website, joyfulmusictherapy.com, to find out more about the company I work for. Thank you so much for listening and learning about music therapy. I want to thank your teacher for reaching out to me and inviting me to talk with you. I hope that if you're interested in music therapy, that this video helped you to understand it better. Thank you again.